Hello, everyone. Welcome to Chapter 15. Chapter 15 is the alteration in blood flow. So let's take a look at this chapter. So, the organization of the circulatory and lymphatic system. So, the circulatory unit involves the absorption and delivery of nutrient. Also, it has the oxygen uptake and delivery function and also removal of waste product. The lymphatic circulation is a specialized system of channel and tissue, and it reabsorbs fluid that leaks from the vascular network into the interstitium and returns it to the general circulation. Without the lymphatic system, we will have edema. So the vessel structure, so we have the arteriole, which is primarily made up of smooth muscle. Venues are composed of connective tissue. Capillaries are a single layer of endothelial cells, and all these changes with age. So thickening of the basement membrane in microvasculature, it will cause narrowed vessels, lumen, uh, and also impaired exchange of the oxygen, nutrient, and metabolic waste. When you have a decreased elastin and increased collagen, when you will have a decrease in the elasticity of the arteries, increase in fibrosis in the media, and thickening of the intima, and you will also have the increase in systolic blood pressure and arterial insufficiency. So anatomy of the arteries and vein, there are three microscopically distinct layers of tunicae. You have the tunica intima, tunica media, and tunica adventitia. As you can see here, the three distinct layers. There's a single thickness of endothelial cells attached to a basement membrane, and spaces in between or between endothelial cells determine the capillary permeability. That also has caused the blood-brain barrier and also the capillary kidney beds. The lymphatic structures are a thin-walled and resembles the veins. They range in size from capillary to vessel of increased diameter, have intermittent valve that extends into the lumen, and the capillary walls contain contractile fiber that propels lymph along the vessels. And here you can see, here are the capillaries right here. And in between in green here, this is the lymphatic vessels. Principles of flow: blood flow, pressure, and resistance. Blood flow is the movement along a pressure gradient within the vascular bed. Pressure is the when blood moves from area of high pressure, which is the artery, to an area of low pressure, which are the veins. And when there are greater pressure difference, there will be greater blood flow. Resistance is the opposing force that deters blood flow. As resistance increases, blood flow will decrease. The determinant for resistance, according to Poisson's law, will be the vessel length, vessel radius, and blood viscosity. Vessel length and viscosity are constants within our body. However, the radius is the one factor that our body controls. As you can see in this diagram here, here's the pressure. Pressure within the aorta and arteries are constant. However, here's within the arteriole, this is where the largest drop due to the resistance. Then you have the venues, veins, and the vena cava after that. The velocity of flow is different within different parts of the blood vessel. So what we have are what is called the laminar flow, and that says that the flow of blood within the vessel is fastest in the middle of the vessel. When the velocity in laminar and turbulent flow, so with turbulent flow is an interruption of the forward current of blood flow by crosswise flow. So turbulent flow will manifest as a bruit, a thrill, and a thrombus formation. Wall tension and compliance. Law of Laplace represent the relationship between descending pressure and wall tension. An increase in radius or descending pressure will result in an increased wall tension. As blood flow through your artery, it will flow against the wall due to the resistance. Dynamics in microcirculation, capillary, and lymphatics. Exchanges of gas and nutrients occurs within these capillaries. It is dependent on the pressure gradient between the capillary and the interstitium through the balance of the four Starling's forces, which are the capillary hydrostatic pressure, the interstitial fluid colloid osmotic pressure, plasma colloid osmotic pressure, and the interstitial fluid pressure. So as you can see here, there are four forces. Two that drives fluid out of the capillary, and two that encourages the fluid to go into the capillary. And these forces are called the Starling's forces. Dynamics in the microcirculation, capillary, and lymphatic. There are changes in the capillary permeability that allows plasma protein to leak out, and that can result in edema. And what causes these changes? Mostly it is inflammation. So impairment of lymphatic flow allowing fluid to collect in the interstitium is called lymphedema. Control of blood. Blood flow is controlled by the central mechanism mediated by the autonomic nervous system, venous and thoracic pump, intrinsic autoregulatory mechanism. Lymphatic flow is controlled by the increased interstitial fluid colloid osmotic pressure, stimulation of contractile fibers, lymphatic pumps. There are intrinsic and extrinsic control of blood flow. Extrinsic mechanism includes sympathetic nervous system and also smooth muscle in the vessel innervated by the adrenergic fiber from the sympathetic nervous system. The extrinsic mechanism releases norepinephrine, result in vasoconstriction through the A1 receptor. There are also epinephrine, which result in vasodilation in the beta-2 adrenergic receptor. And then you also have the venous system flow controlled by the pressure gradient from vein and venous and thoracic pump. Intrinsic mechanism of blood flow includes the autoregulation, which is the ability of blood vessel within the organ to maintain a relatively constant blood flow regardless of changes in the arterial pressure. So high blood pressure leads to the stretch that result in constriction of arterial and the precapillary sphincter. When you have low blood pressure, that causes vasodilation. Reduction in flow impairs ability to transport gases and nutrient to blood tissue, resulting in hypoxia, ischemia, venous engorgement, and venous obstruction. Blood vessel obstruction, they may involve arterial or venous obstruction. So obstruction result in reduced flow beyond the obstruction, which is called downstream, and also increased pressure before the obstruction, which is called upstream. In the arterial system, obstruction manifests as distal ischemia. In the venous system, obstruction manifests as edema. Thrombosis is a stationary blood clot formed within the blood vessel or a chamber of the heart. Arterial thrombosis result in ischemia. Venous thrombosis result in edema. Prophylactic intervention include oral parenteral anticoagulant therapy or a drug that blocks platelet activation or aggregation. Once a thrombus has formed, anticoagulant therapy is initiated to prevent clot enlargement. Embolus is the material that forms a clot within the bloodstream. Embolus leaving the left ventricle will travel to the brain and which causes the ischemic stroke. Embolus leaving the right ventricle travels to the lungs and that causes pulmonary embolus. Treatment involves anticoagulant therapy, embolectomy, or a filter in the inferior vena cava. Vasospasm is a sudden constriction of arterial smooth muscle resulting in obstruction of flow, may be mediated by hormonal changes, food additive, or environmental factor. The manifestation include prinzmetal angina, hemorrhagic stroke, migraine headaches. Inflammation can increase risk of thrombotic processes. Inflammation includes vasculitis, phlebitis, and arteritis. Mechanical compression are external forces to the vascular system that may result in partial or complete obstruction. It may be caused by the trauma, the casting, dressing, or stocking. So, one of the most important mechanical compression is called the compartment syndrome. Blood vessels, structural alteration. Types of structural alteration include valvular incompetence, arteriosclerosis or atherosclerosis, aneurysm, arteriovenous fistula. Thromboangiitis obliterans, also known as Buerger's disease. It is a rare inflammatory condition that affects small to medium-sized arteries and veins of the upper and lower extremity, resulting in varying degree of obstruction. Treatment involves smoking cessation, if the patient smoke, and the use of prostaglandins. Raynaud's syndrome. Raynaud's syndrome is an extreme vasoconstriction producing cessation of flow to the fingers and toes. Intrinsic structural factor, extrinsic neuroregulation, and locally produced mediator are involved. Treatment is directed towards enhancing circulation through biofeedback, relaxation, calcium channel blocker, sympatholytic drug, and prostaglandin as well. Aneurysm is a localized arterial dilation, classified as true or false aneurysm. It is frequently found in the cerebral circulation and thoracic and abdominal aorta. You also have a dissecting aortic aneurysm, which is a medical emergency and treated medically and or surgically. Here you see the vascular and the fusiform types of aneurysm, which are the true aneurysm, and then you will have the false aneurysm and dissecting aneurysm at the bottom. Acute arterial occlusion. So the absence of the arterial circulation, which is an emergency, that may result from the thrombi or emboli or mechanical compression. So the classic signs and symptoms of the arterial occlusion includes the 6 P's, which is pallor, which is the whitening or the blanching of the area distal to the obstruction. You have paresthesia, which is numbness, paralysis, pain, polar, and pulselessness. So if you do not have any blood traveling through the arteries, therefore you will not have a pulse in that area. Alteration in venous flow includes incompetent valves, and that involves obesity, pregnancy, right heart failure, prolonged standing, that produces varicose veins, chronic venous insufficiency, and obstruction by deep vein thrombosis, also known as DVT. It is accompanied by edema, venous stasis ulcer, and pain. DVT can be life-threatening. Valvular incompetence. Overstretching of the valves owing to excessive venous pressure resulting in backflow of blood that results in venous insufficiency and varicose vein. Treatment is directed towards smoking if applicable and regular exercise. Varicose vein are impaired venous return that results in increased capillary pressure causing edema and superficial darkened, raised, and tortuous vein. Greater saphenous vein is the most commonly affected vein. Treatment is directed towards increasing venous flow and reducing venous pressure. Sclerotherapy and surgical intervention may be used for severe cases. Chronic venous insufficiency. Chronic venous insufficiency may result when valvular incompetence involves the deep veins. Venous stasis ulcers are typically present. Venous ulcers are treated with compression therapy and infection control. Deep vein thrombosis, also known as DVT, it is the most frequently due to thrombus in a deep vein of the lower extremity. It may be asymptomatic. It is treated aggressively with anticoagulant therapy. Previous DVT is a risk factor for further hypercoagulation. Lymphedema. Lymphedema occurs when normal flow is obstructed or altered in some fashion. Primary lymphedema due to congenital anomaly or dysfunction of the lymphatic system. Secondary lymphedema associated with a disease process or iatrogenic. Typically affects extremities. Interventions are medical, external compression therapy, and exercise, and surgical resection of the subcutaneous fatty tissue. This concludes chapter 15. Have a wonderful day.